so many patients are hard on themselves, and that makes it harder to change.
Good morning, everyone. Welcome back to In the House podcast. I am Toni Singh.
Good morning. I'm Jenny Woon.
We have a very special guest today, Dr. COURTNey Campbell. Hi, Dr. COURTNey.
Hi, Toni.
Welcome to our show. And today our topic is burnout. Yes, people in the real estate profession, you heard me. We know you've experienced it at some point or another. And Dr. COURTNey is a jack of all trades. Should I let you introduce yourself?
Oh my gosh, I guess. Yeah, you're putting me on the spot. I can do that.
Okay, we'll let you introduce yourself.
Thanks for coming in person, by the way.
Yes, she's
Thanks,
in
Jenny.
person.
So, well, thank you girls for having me. My name is COURTNey Campbell. I am a naturopathic doctor, practicing locally here in Burnaby. I've been an ND for over, I want to say 12 years. So this is my 12th year in practice. I co-own a integrative clinic in Burnaby. So myself and a chiropractor, we own the clinic together, and we have other chiropractors working with us. We have registered massage therapists. We have acupuncture in the space, and we have other naturopathic doctors. So the mission and kind of goal of our clinic is, kind of a whole health approach. And what people really like about coming to see us is they can come to see us for, maybe their kind of general nutritional health concerns, what it might be. And then they can also see our chiropractor, and they can also see our massage therapist and our acupuncture. And it's a really kind of great one-stop shop. So that's the nature kind of my practice.
And the clinic is called Aurora Integrative Medical Clinic, or AIM, correct?
That's it. Yeah. Aurora Integrative Medical.
Okay. And also, wait, an important thing too, in addition to all of these things, you're also a mom of two.
I am. Yeah.
So how do you fit everything in? Because we're going to talk about burnout, and we have some questions for you. But what does that look like in your life?
How old are your kids?
Yeah, my kids, my eldest is 4.5, Althea, I have a daughter, and my son Beckett is 2.5. I don't know how I fit it all in, but I somehow do pull it off, and I think I'm not quite at burnout. I feel like myself personally, I am. There are definitely times that I feel like I'm kind of approaching that place, but I do think I have a pretty good handle on keeping it together for the most part.
Our first question that we always
First
forget to
question
ask
before the first.
Oh, gosh.
is what is your spirit animal?
Oh, okay. Jeez, my spirit animal. I mean, I'd like to say it's something, hardcore and cool, like a leopard or a tiger, but it's probably more like a gopher or a beaver, like a chill, some sort of chill mammal.
Okay.
Yeah.
You are very chill.
Oh, thank you for that.
Unless you're in doctor mode.
Yeah, and I might
you're
be in
like,
doctor mode. I don't feel chill often on the inside, but
Got it.
For your practice, how many partners do you have that own the practice? the
myself
clinic?
and my partner, Dr.
Amber.
Amber Eckel.
Okay.
Yeah.
Okay.
Yeah. Okay, so I'm going to go into the next question. We kind of touched on it, but basically you said that right before you get to that phase where you almost feel burnt out, you stop yourself. So how do you stay in wellness and prioritize your self-care whilst managing the clinic, your patients, your kids, all of that?
Yeah, that's a really good question. I could probably talk about that for hours.
Well, we want to hear
Yeah.
because I'm sure it'll give us tips.
Yeah. And I think about this a lot because I wonder sometimes to myself, how did I make it through this week? Or how did I make it through today? Today was such a big day with patients and life and kids and daycare drop off and home and family and all this stuff. For me, and for my husband and myself, we kind of do this together. We really prioritize sleep, nutrition, and exercise. And that doesn't mean that that's what everybody needs to prioritize. But I know for us, we've really found that those kind of are big pillars for us. And we really try not to compromise on them, right? Almost like that's religion to us. So getting 7 to 8 hours of sleep a night, like we just don't compromise on that. And if that means we go to bed at 8:30 and we do nothing fun, like put down the kids and they're screaming and it's a late bed night and whatever, and we go to bed at 8:30, like that's what we do. We go to bed. And we exercise pretty much every day. My husband definitely, he's more of a 7+ times a week exerciser. I'm more of like a 6 to 7 times. I'm a little bit more reasonable than him, but that's just like, that's a pillar of health for us. And we don't compromise on that. And we know that we always make time for each other. And it's crazy when you have kids, right? Like no one, before kids, you can exercise at the same time. It's quite lovely. But when you have kids, it means only one person can go at a time. And we will just accept that our morning is extra crazy and extra early so that we can both work out. And then the nutrition piece, and that comes, maybe a little bit more inherently and easy to me because I am a naturopathic doctor. But, every meal for us is about nutrition, and it's about nourishing and making sure we have energy to get through the next steps of the day.
So do you guys meal plan for that, or?
Yeah, my husband would like me to meal plan more, because I complain that he doesn't help enough. And he just wants me to say, like, put that, do this and do this and do that. But I think it's more we really have a good routine in place of, these are the things we eat for breakfast. We know where they are, that we know how to kind of put them together. Same thing for lunch, kind of same thing for dinner. We're not people that do a lot of takeout and order in often. And not that there's, any issues with that. But I think that because we have a lot of control over what we eat, that really helps us kind of making sure that we're nourished all the time properly.
That makes sense. 3 pillars. Everybody knows them. We don't always practice it, right?
Totally.
So what does your, I guess, average day look like? So obviously there's the meals and then the sleeping. What's happening in between?
Yeah, my average day, and I wouldn't copy me necessarily, but because that's your question, I get up at 4:45. We usually work out. So probably from like 5:30 to 6:30, whether it's like going to the gym or going to the pool or going for a run or whatever. Then I come home, and then my husband goes and does that. Then he comes home. Then all this while I'm getting ready for the morning, getting ready to head, get the kids out the door type of thing. I'll drop my daughter off at daycare, and then I head to work. And work is super fun for me. I love being at work. It's crazy, and the days are super full, and I feel like I don't have enough breaks, even though I do have breaks. But I really enjoy kind of the doctoring part of my day. And then close to the end of the day, I try to finish up my charts and paperwork and do kind of the housekeeping and the management part of the clinic piece. And then I run home and grab my daughter and run home, and then, kind of engage in meal prep and prep for the next day. We always go to sleep. Everything is prepped. Water bottles for the gym are prepped. Kid stuff is prepped. Everything is prepped so that we can wake up at 4:45 and do it all again. So we don't really give ourselves a chance to just wake up in the morning and go, oh, we can't do that today. I'm too tired, because we've kind of laid it out.
See, even listening to that, for me, it sounds a bit exhausting, because my days are similar, but I'm not prioritizing the workout piece at that time in the morning anymore. I just kind of let that go.
Yeah.
But so do you guys take vacation then? When do you actually reset? Or is this like, do you have actual time off where you can reset and then complete these things on a daily basis, or you don't need the rest time at all?
Do you mean resting from exercise, or just like resting
like
from
that
doing
day
stuff?
sounded really tiring.
Yeah, and I don't work full time. I don't do that 5 days a week. I do that more like 3 to 4 days a week. So Grant and I are we enjoy having kind of our 3-day weekend together. And that's also just, to kind of get stuff done and get caught up on, groceries and house stuff and everything, so that we can kind of pull off those crazy long kind of work days.
But it sounds like your Grant and you have this like really good flow.
Yeah.
You have to have a partner that's be willing to be as organized as you.
Yeah. And I think that I know that my patients that have a harder time prioritizing exercise, it's often because they're just so tired, right? And maybe the time of the day that works best for them, when they look at their schedule, would be to exercise in the morning, but they're just too tired. Like they wake up in the morning and they think, like, Dr. Courtney, like, I can't exercise at 5:30 or 6 or 7. I wake up, I'm so tired. I'm basically, dragging myself through the morning, caffeinating myself to stay awake. And then I go to work and I come home from work and I'm so tired. So I absolutely get that that's not kind of the case for most patients. That's not where most people are at. There you go.
Oh, what kind of tips and tricks can you offer to people who just don't have that routine? Like, obviously you found your groove already, but the ones that have not found their way to enhance like their wellness, to enhance their immune system, how do they build it into their like daily practice?
Yeah, that's a great question, right? So I think that where I work with most of my patients on that is, so yes, I love that word routine, right? And our adrenal glands, our stress glands, they like routine. They want that. They want wake up same time, eat kind of same times, go to bed at same times. I like to work with patients on figuring out what the challenges are, right? So these are your goals. I would like to, wake up at X time and exercise this many days of the week at this time, right? So kind of get a clear idea of that, and then figure out the reasons that we're not able to accomplish that. So fatigue, which I already mentioned, that's a big one, right? Time is another big one. Maybe not having enough kind of downtime and prep time in order to pull off a routine. So, I mean, it takes time to make sure you have groceries that you can eat that are healthy in your house, right? And if you're working, and I'm sure this happens in your industry all the time, if you're working 7 days a week, like when are you getting groceries to, be able to cook at home? I don't know.
That's true.
So I think that figuring out what your goals are, figuring out what the challenges are, that's usually where I kind of start with patients.
That makes sense.
What is okay, burnout is such a common word that we often use in our industry.
Yeah.
Can you give us a definition
Sure. That's
of
a good one.
what burnout is? Like, what does that physically look like? What does that emotionally look like? Because we probably don't see the red flags or the symptoms until we actually just fall apart and don't even want to get out of bed.
Thanks for asking that. So the term burnout, it's not really a medical term, but it's but everyone connects with it and kind of gets it, right? Like when you say to someone like, I'm approaching burnout, or if I use that terminology with a patient, they're like, okay, I get that. I've seen colleagues and friends and family members experience that. So on a hormonal level, on a physiological level, the types of things that I see when patients are approaching that space is usually their cortisol and their hormones related to their cortisol aren't balanced. They're not doing what they're supposed to be doing. And cortisol is our stress hormone. So it is used to being high at certain times of the day and low at other times of the day. And when it ceases to kind of follow that pattern that we would expect it to follow, we know the body's starting to struggle a little bit. So that's kind of an objective marker that we see, and that's something that we can test for. So when I have patients that come in to see me and they say, I think I'm approaching burnout, or they kind of just tell me about their life, and I look at them and I think you're approaching burnout. Then we will, we'll normally do some hormonal testing to maybe assess what their stress glands, what those adrenal glands are doing. Something else that we can see objectively, so with lab testing, is sometimes their thyroid gland, which is, controlling their metabolism. That starts to kind of change a little bit too. In terms of, subjective things, so things that people are feeling, fatigue definitely later in the day, and not necessarily like nighttime, but fatigue after lunch, fatigue after eating oftentimes. So, when you're a little kid and you eat, now you're like bouncing off the walls with energy. When you're approaching burnout, it's more common to see, I eat and now I'm like super fatigued. Like I feel rough. I thought I was supposed to eat and like feel amazing. Now I just feel like crappy and tired. So that's another kind of big one. And then just mood. We definitely start to see mood changes when patients are approaching burnout. And that's, them reporting, I almost feel like my personality is different. I'm not usually so anxious, or I'm not usually so irritable, or I'm not usually so like sad and down about things, but I have been more in the last, 3, 6, 12 months, whatever it is. So those are kind of some of the main things that would trigger me to think, okay, yeah, we've got maybe some burnout going on and we need to investigate that a little bit further.
Okay, those are good tips. And I like the objectivity component to it as well. I'm curious if among all of the many patients that you work with, are there any health-related conditions that would be related to specific professions?
Oh, good question. Meaning like I see this type of condition a lot in this profession.
Yeah, I'm just curious.
Yeah, I see a lot of accountants being very stressed out and approaching burnout. This is completely like, I'm just generalizing here, of course. There's no data on this. I see a lot of law enforcement individuals.
Especially right now.
PTSD probably.
Yeah, and just they are used to working such long hours that overdoing it is normal. That's another thing I see a lot in nurses. It's like normal and kind of expected for them to be able to operate at a high level of discomfort. And that's not necessarily healthy, right? And I definitely see this in your profession, right? And I'm sure probably when, realtors get together and chat with their other friends that are not realtors and you kind of compare like what the definition of a long day is or a long week. Hopefully, I hope that comes up for you that you go, yeah, we work maybe more than the average bear.
It's funny because Courtney's in the studio right now, and when she was describing the burnout and everything, she was looking at me.
Oh my gosh.
You made me do all those tasks.
Oh my gosh. What's that?
Do you mind sharing what you've gone through with?
No, not at all. Okay. I'm an open book. What do you want to know?
Well, why did you start seeing Courtney?
Okay, so this is a funny story. I'm going to share with you. I'm going to answer your question. But it's funny because you're kind of a big deal.
What?
Yeah, you and Amber are kind of big deals in Burnaby.
Okay.
For people that live around that area that are seeking out really amazing healthcare practitioners like naturopath or chiropractics and other. I know you guys have around 15 other people that work at the clinic, right?
Yeah.
Something like that. Well, also, I've worked with you before in my profession too, so I knew you, but your name kept coming up. And so that's why I just know you as a person, and I know how you have attention to detail. So I was like, yeah, I'm going to go see Courtney. But for me, I noticed in the summertime, coming off of that last market that we were scrambling for all over the place, that I started feeling really tired again. And I probably caught it too late because I knew that I was tired and then I couldn't recover. It was like over the summer, I wasn't working as much by choice. I was actually purposefully not taking certain things. And it was weird because I actually couldn't recover. I'm like, I'm actually exhausted. I can't recover. The rest is not helping. And then I felt some, I've dealt with some health stuff. So I felt some changes related to those past conditions where I'm like, oh, I better go see somebody right now because I'm noticing this and I can't fix it myself. And that's when I saw Courtney. Then she did a whole bunch of tests and said that she would not trust my own medical assessment of myself. Because why did you say that?
Well,
you can share. You can be open.
And thanks for being okay with me sharing. In this situation, it's just I find Toni to be such a high functioning individual, which is like a compliment / diss in that Toni can put up with a lot, right? Yes. Like she can put up with a lot of crap, and Toni's perception of discomfort might be different than maybe the average person's perception of discomfort. So here's Toni at like a 12 out of 10 discomfort, and she's going, I'm a little uncomfortable. So do we trust her when she says, I'm this amount tired or I'm this amount, having poor sleep or this amount uncomfortable? Maybe not, right? Because she's been doing it for so long. And patients that are really good at overdoing it, they're the ones who we like to do objective testing with because we can't just kind of take their word for it of, I'm suffering a little.
And so the process, she did the objective testing.
Yeah,
and I think
know more about
you can,
the actual
and I'm
testing.
giving you permission right now to share. It's okay.
Thanks, Toni.
I know there's a confidentiality thing, but did my testing, my test results basically confirmed what I was like?
So the meter was a meter
right?
on the red. Basically,
it was not good.
Yeah, it was over there. Yeah, we Toni needs a little support.
So as a result of this,
so what? Let's go down into the testing itself.
Yeah, go ahead.
What is the actual method?
Blood tests.
Oh, blood test.
Yeah,
okay.
In Toni's case, we did blood tests.
Okay.
And I have way more tests planned for Toni too.
I'm aware.
In Toni's case, we started with some blood tests. So, looking at iron and looking at B12 and looking at vitamin D and looking at glucose and things like that. For some patients, depending on what's going on for them, we might not start with blood tests. I really like doing hormone testing. I love it, love it. But oftentimes for hormone testing, it's actually better to do urine testing. So I do a lot of that. That's on Toni's to-do list. It's coming up when she does the things. When she does the things I told her to do, which she's working on. And in Toni's case, things were low. Things were low.
So, and that's the thing. As a result of that, there was an action plan that was put into place based on the objective results that we obtained. And one of them was going for, what is it called? Those iron infusions?
For iron infusions, yeah.
Yeah, and it was funny because my experience with that was I'd never had them before. And on the day of, and we split it into a bunch of different appointments because I have other stuff happening, but I didn't feel anything right away. And then a few hours later, I'm like, holy, is this what it's supposed to feel like when, because I'm still producing, right? I'm still producing, I'm still running at a high level, but the energy's not there. And then after that, that only stayed for like half an hour.
Okay, so
and then I was like, no,
go back
it was
to
not
the
good.
holy. Like, let's draw you back into what is that?
Are you coaching me right now?
No, I want to know. I'm really interested. I don't know if I'm low in iron.
This is what it felt like. It was fucking amazing. My mom listens to this podcast. She told me not to swear. Sorry, Mom. But the only way to describe it was like, I'm like, holy, is this what it feels like? Like, energy-wise, it felt, I felt energetic. Yeah, I felt not tired. Like, it was interesting because the contrast of that, of how I operate every day, is actually like I'm exhausted every day and I'm still not taking things off of my plate. I'm adding things. So it's like running on fumes is what I want to say in terms of energy levels. And to feel that much energy, I was like, holy, if I felt this every day all the time, how much more could I get done?
Oh, right.
Which was not the right thing.
Exactly.
Oh, gosh.
So if your plate's at 110%, did you think right then at that moment you're going to take at 150%?
Yeah, and that's we're working on that, the hyperachiever thing, which I'm trying to get into check. But automatically I'm like, oh my gosh, I could do so much more. And then I started making these plans. And then that's probably what happened. I was like, oh, now I'm tired because it's worn off now. Those and I'm thinking of all these things I want to do.
Well, I'm glad that was your experience though. And I'm glad you had that brief aha moment of, oh my gosh, if I was feeling okay, I could do so much more stuff. And then your body put you in check and made you tired again.
Like, nope.
Right. So, and just thinking about like, what's the root cause of what's going on? And this is a big thing we do in naturopathic medicine. We're kind of, it's one of our tenets, something that we're very interested in. And we like doing all these evaluation and doing like super thorough intakes and doing testing and, kind of assessing what's up right now. But we also really like asking, big picture, what's going on here? Like, why did this start in the first place? And that's not necessarily information that's in front of you right now. That's, you really, really kind of having to think. So in your case, like, why are you tired in the first place, right? Like, why would Toni's iron be so low? And so, like, the fact that you are so good at overdoing it, I would say probably contributes to that. And just, quick thing on iron. So, for instance, when a patient's, and I love iron, I love testing it and looking into it. So when a patient's iron, in your case, Toni, is really low.
Makes me want to go get one.
You probably should, and then we can compare results.
Well, you start with testing. So say you come in, patient comes in, and they're really tired. And, we've evaluated all these things. And I'm kind of just looking at them and maybe doing some physical exam, looking at their eyes, pressing on their nail beds and kind of going like, oh, you know what? I think you're kind of low iron. Let's evaluate you for that, right? Let's send you for some testing. We do the testing. It comes back, oh my gosh, this is like super low iron. What iron is doing is it's making it so you can uptake oxygen in your body. Oxygen is what is allowing your cells to operate optimally. You need oxygen. It's super important to everything that is going on physiologically for you. So if you are low iron, imagine it's just like we've turned down the dial of productivity on your body. You're just not. I know. You're just, it's not worried. It's good though. It's good information. So imagine you're just not as effective as you could be. But meanwhile, we have patients like Toni who are super high functioning and they're like, they wake up and I'm kind of tired today, but this is my to-do list and I'm going to get it all done. So I'm powering through. And now I'm kind of pushing myself into this fight or flight mode. I'm overdoing it. I don't necessarily have the gas in my tank for this. I'm like running on fumes, but I'm going to get it done. And so that situation, that overdoing it without gas, the driving without gas in your tank, the overexpending yourself energy-wise when you didn't really have the oxygen to do it properly, the fact that requires you to be stuck in this fight or flight mode, that's what creates burnout.
Okay, that's interesting. I've never heard it explained that way. Have you?
No, it's it's so easy to understand.
We both experienced burnouts.
Yeah, mine was more than 10 years ago.
Yeah.
And I feel like I have a very good balanced life now. I don't have problems with like nail growth, hair growth. I have a lot of energy. In fact, so this is like extreme opposite. I have too much energy and people wonder how I operate. So I don't drink caffeine. I don't drink tea. Like I don't drink coffee. So I'm pretty like a calm, even keel person. Cool. But I can run off of like no sleep.
Oh dear.
Or like I can have 8 hours sleep. It feels the same to me. But my average number of hours of sleep is like 3 to 4 hours.
I thought, so you remember before last year how you made that commitment to sleep for more hours than 3 to 4 hours?
Oh, I'm asking for a friend right now. Sorry.
But I'm just going to wait. We're going to stop for a second. So do you feel like you need a couple additional hours, or you're like, because I wonder, in the hyperachiever in you, we have that tendency.
Mm-hmm.
I wonder if, because you've been doing that for so long as well, you do have high energy. It's much higher than mine, but I wonder if that's an accurate description of how you actually are, because you're just used to running on no sleep.
If it's an accurate description of who I am.
Well, you do have energy, but is there a different, like, is there something missing, or is there a different way that you're just not aware of because this is how you've always done things?
I don't know. I
and
just,
that's why
I don't feel tired ever to want to go to bed.
And so that's
ahead,
neat,
Courtney.
right? Because so this word energy, right? That's a perception thing.
Okay.
So here's you, Jenny, thinking, well, I have energy and I'm not tired, so I must be fine. I mustn't need to sleep.
Okay.
But it is possible to overdo it so much that you've kind of taught your body that you spend more time in fight or flight mode, or what we call sympathetic mode. Like you've taught your body, like, this is what we do. This is the level at which we operate. We go all the time, super fast, So it doesn't know and is not comfortable really hanging out in what we call parasympathetic mode or rest and digest mode. So you've kind of trained it, because we also train hormones to do the same thing every day. They like it. They also really like routine. So you may have sort of, out of a habit of overdoing it. I'm just theorizing here. I have no
It'd be
actual
interesting
idea.
to see the test results, though.
It would. Oh my gosh, I would love to see those.
Yeah, I'll definitely go see Judith for that.
Yeah, please do.
I never had done an iron test, or I did for fertility reasons, like for fertility testing. But I'm always assumed that because I don't eat red meat. That was like I don't know if that's like more of a myth, or like I don't really know the study of it, but. Does that have anything to do with red meat?
Yeah, and you know what, ladies, we're talking about, like, there's so many reasons why, we have physiological reasons, right? So we're talking about iron, and this, I think actually, Jenny, your thing kind of sounds a little more hormonal, and it doesn't mean yours isn't, Toni. That's where we started. Toni's got a long list. We started with that. But reasons for low iron could be intake. For sure. Meaning, do you have iron in your diet? And, red meats have iron in them, but you can still get iron from non-red meat dietary sources. So, and you can get iron from fish and chicken, poultry, this type of thing. Mm-hmm. If you are a vegetarian, but you still, maybe have some animal sources of protein, so eggs and dairy and things like that, you probably will pull iron out of those too. And if you're a vegan, so you're not eating any animal protein whatsoever, you can definitely get iron from veggies. It can be done. You can do protein combining. It's possible. It's just that if you are crummy at absorbing iron, so meaning your digestive system isn't in a really good place, it is harder to pull iron out of vegetarian sources. It just kind of is. Okay. Because they have, per gram less iron. So if you go and eat a steak, there just is a lot of iron in there versus eating a ton of all the greens that have iron. But if your digestive system's in a great place, you probably can get enough iron from a vegetarian diet. But you know who has crummy digestive systems? Take a guess. Burnt out people.
So, because I was going to say, I eat tons of iron-rich foods. It does nothing for me.
You
saw the results. Nothing.
Yep. And because if it's an oral thing, right? Your digestive system is what is making it possible for it to go from food into your mouth, through your digestive system into your blood. So if your digestive system isn't in a good place, it's not going to do that. And remember, I just talked about fight or flight or rest and digest. And it's or. Your body's pretty much operating in one of these two spaces. So if you're in a lot of fight or flight and you're like down in steaks and like beef protein, you're doing all the right stuff, theoretically, dietary-wise, to get iron in. If you're in fight or flight mode, you just might not break it down and absorb it. It's actually fascinating.
Gotcha. Well, I can tell that you're fascinated about it.
I know. Using lots of hand motion.
No, it's good. So
it makes sense because I went to see Judith for like gut and digestive, just because I got food poisoning like a month and a half ago, and I was like, this is a really good time for me to really investigate what's going on in my body. And I mean, I legit had food poisoning, but it just really opened up my mind to seeing like, okay, I got to take care of myself a little bit more on my eating habits.
Yeah. Cool.
But yeah, going back to like energy as being like more of a, I guess, passive word to use.
Yeah.
Best way to describe ourselves. So what are some habits if my hormones are so used to the habit of like not sleeping and just creating work for myself after like these decades, how do I like change to the proper like rest and reset?
Yeah. Like, how do you get back on schedule?
Yeah. Like I just, to me, it's like, who
It's
the heck
not,
needs 8 hours of sleep?
Yeah. Who has time for 8 hours of sleep?
This is the thing. She'll email, and I used to be this person too. And then I had kids, and I'm like, no, I have to sleep a bit longer. But she'll email me at 2 or 3 or 4 in the morning, and I never actually knew what that was like because I used to be the one sending those, and now to receive it, I'm like, why are you awake at this time?
Yes,
I don't understand why people like. The other day, someone's like, "Are you still awake at 4?"
Like she's awake the whole time.
But why do you ask me that? Like, that's my life. I'm not telling you to go to bed at like, why are you going to bed at 10 o'clock?
I don't mean it in an offensive way.
No, she's just concerned.
It's a caring way.
Yeah.
No one needs to be concerned.
Well, and I really love that you brought that up, Jenny, because a lot of my patients, when they share that they only need, X number of hours of sleep, of course I believe them, right? They know their body. So if, they only need 6 hours of sleep, I believe them. In some cases, though, depending on how much they're getting done during the day and kind of powering through and what their the mental, emotional, physical demands have on them, I might argue they could function more optimally with more hours. Now, meaning if someone says to me, I only need, and so in your case, it kind of sounds like you're saying, I only need 3 to 4 hours of sleep. I would say, okay, I believe you, right? Because these are your goals for the day and you're meeting them always and you're feeling calm and you're feeling good and you're not feeling of ill health. I would suggest considering, though, is that sustainable long term?
Oh, right? I may die earlier than all of you guys.
Yeah, well,
gosh. I'm so happy Dr. Courtney is here.
But I don't need to be doing things when I'm like 60 years old. I'll be like retired and I'll be like,
yeah, if you live to retirement.
Yeah, interesting. What an interesting
I'm not
take.
too far off of that, actually.
Okay. Super concerned right now. This is a discussion for another day.
Well, have you tried, Jenny, sleeping longer? Or is it that you can't fall asleep or can't stay asleep for longer?
I have no problem falling asleep. I have no problem getting up. So it's not like
interesting.
Yeah, like I could be going to bed at 10 and I'll wake up at 5, 6 in the morning to do my stuff. I could be going to bed at 4 and getting up at 6, no problem too.
I'm going to remind you though of about a week and a half or 2 ago when we were together. We spent 3 lovely days together commuting to the Mike Ferry retreat.
Yes.
And I know that there was other like you had a lot going on then, but do you remember right after the conference, you went home with the intention to eat dinner, you would fall asleep, and then you woke up in the morning before we had to leave?
Woke up and yes. Okay, so
I'm just saying this is from a place of love.
Conference
she was so tired.
Sitting there for like 8 hours like straight,
I know. Okay, it could have been that, but I'm just saying also maybe because you were sitting for that long and you weren't like go. I don't know.
Yeah, so Jenny, when you don't have stuff to do, when you're not busy, are you then tired?
I never have.
She always has something to do because
like you're uncomfortable with the idea.
Yeah.
Like if I told you, I just want you to go to the movies, no phone.
I could do that.
But would that make you tired?
You know what? The one thing, okay, I will admit, most people don't want to go to the movies with me because I fall asleep.
Oh, that's terrible. I would never go to the movies with you.
So what you're saying, Jenny, is when we take your body and we plunk it into rest and digest
when
mode,
it's not doing anything,
your body goes, oh yeah, I am actually quite tired. And that's neat. I think that's super neat feedback.
50% that and 50% it's a boring movie.
Okay. It would be, if you had time, which I don't know if you do, but if you have time, I would encourage you to do more experiments like that. Like check in with your body when you are not in fight or flight mode. And whatever that looks like for you, whether it's, I'm going to shut my phone off and I'm going to sit here with a cup of tea and I'm just going to breathe. Or I'm going to go do some, yoga. And even if you don't have time to go to a class, I'm just going to like do some YouTube yoga, or I'm just going to sit here and read a book, not on a screen. I'm going to read like a paper book and see if putting yourself in those rest and digest moments, how does that feel? And do you feel tired? Or do you feel like equally energized as you are on your like Energizer Bunny mode all the time?
I did like a silent meditation all day last Saturday.
Oh, cool.
And it was silent from 9 to 5 without my phone. And I was awake the whole time because there was like an intention behind that exercise.
Okay, yeah. And you know that's almost not maybe the right experiment, because that's, you know, you were also...
There's an intention. You had to stay awake for that.
Yeah, okay. But yes, I do, like for movies...
but for movies specifically.
Well, I mean, if it's at home, I do watch it. But like if it's at the theater, it's like pitch black. And I'm usually like, you know, cozy up in my sweater and stuff like that. And like, yeah, usually I'll fall asleep.
After more of your visits, Jenny, with Dr. Judith, who's my colleague, you can report back on your...
I'm curious. I'll report back.
Yeah, report back.
Okay. Yeah. Anyways.
This might be a silly question. But I'm going to ask it anyhow, because I think like it's a foregone conclusion. But if you could give your top 3 tips for staying in excellent health, what would those top 3 tips be?
On the spot. I like the question of, I like more things like, what would be the herbs you would take to a desert island? But I will, I'll answer this one.
I have a follow-up question to that.
Yeah. So your question of, you know, kind of top 3 tips. I think... And this might not necessarily be the same for myself as more kind of what I see in my patients and what they need more of. I do think people need more sleep, and I don't think it gets prioritized enough. And I think, and this is what I see in my patient population, and especially in those of us that have kids, is it's this like, come home, everything's crazy, dinner time is crazy, got to get these people to bed, everything's crazy. And now adults want to be adults, right? Like they've got this time, the kids are in bed, and they don't want to just go to bed 30 minutes later. They want to, you know, hang out with their partner, their spouse maybe for a little bit, or their pet, or they also, you know, they have 3 loads of laundry to do and all these things. So
true.
Finding a way and a balance with that, still feeling like you're honoring yourself and your own downtime, but knowing like you can't go to bed too late here, people. So I think that, so really prioritizing it. Like it's just so important. It is more important than that other load of laundry. And as parents, especially, just in the same way that everything that our kids are doing is more important than our own, you know, stuff. Same, now that the kids are out of the picture, it's now your sleep. I think that the next thing would be, oh no, I'll save that for last because it's really good. The next thing I would say that I see, and it sounds super cliche, but it's water. People are crummy. And and I get it, because I've gone through times, you know, in my life of not being good about water. But it's so important to be hydrated properly. And I should do little mini studies after visits of write down, you know, all these, you know, how many patients today were all their issues. I could just trace them back to water, their digestive issues and sleep and skin and all this. But just making sure that you're properly hydrated. And we could do a whole chat about like caffeine and water and how, you know, coffee is not water.
You gave me that speech in your
I
office.
did. Oh no, I drew you a diagram and everything. So just, you know, making sure we're having enough water. And I mean, you can kind of look at research on this, but I like saying, you know, 2 liters plus a day. Just start with that.
That sounds brutal.
That
It's
sounds
hard
brutal.
for me to drink
Me
water.
too.
It's
Goodness,
really hard.
when you've got your beautiful water bottle there. So just fill that up 2 times, please. Fine.
I can fill it up, doesn't mean I'm going to drink
Oh,
it.
gotcha. And then the third one I would say is finding time and space to love yourself. And that sounds kind of kooky and, you know, a little corny.
No, but what does it look like?
What does that look like? So just recognizing that in order to move forward with your health goals, in order to kind of get to that next step, you need to be your own best friend. And I have so many patients that do so much negative self-talk, and they're doing it in my office with me. They're sitting there saying, well, the reason I don't exercise is I'm not motivated and I'm lazy and I should be doing it. Or the reason I'm, you know, eating poorly, like it's my fault. I know I should be doing better. And, you know, they're hard on themselves. And I'm listening to their life and their day and their circumstances, and it's hard. Like they might be in really tough situations where it's hard to have energy and find the kind of time to do all those things. So getting out of that kind of negative self-talk space, talking to yourself how you would your best friend. Like, you know what? You did a great job today. And if we can maybe do things a little differently tomorrow, we'll kind of try our best. And that's, like I said, it sounds so general, but so many patients are hard on themselves, and that makes it harder to change what's going on, right? If you were putting your friend down all the time, it's going to be hard for them to change their habits.
I love how you said that. That's important. Yeah.
Okay.
I actually have a funny story from yesterday. One of my really good friends had called me. I hadn't spoken to her in a few weeks because, busy, which I hate that word, but I was busy working, as was she. And she was whispering. I said, hey, why are you whispering right now? You called me. Why are you whispering? She says, I'm getting my vitamin C drip done at Aurora. I'm like, oh my God, we go to the same place. We go to the same place. And she's been going to you guys at your clinic.
Oh, great.
She actually sees you. I won't say her name on the podcast because private. But you're her naturopathic doctor. And it was so funny because I had never known that. But again, your name keeps coming up for a go-to-see person in Burnaby, and Amber too for chiropractics as well. Okay, so thank you. You have such high energy.
Oh my gosh. Well,
and you're really good at explaining all these things to people like us.
She's got a good routine.
Yeah, you have an amazing routine. I should start on that. But I guess, can you, just for our listeners who are wanting to look after their own health, and I realize that everybody's in a different stage in their journey, right? So I think we've talked about this before too. Health is definitely wealth. If any of our listeners are wanting to get in touch with you or your clinic for health support, what's the best way of them getting in touch with you guys? And I guess maybe explain a bit about the professionals that you have there, because you also have an osteopath too, right?
We do. Yeah.
So we'll give you a few minutes to just go over that, because I'm sure there's people listening that would like to book appointments.
Yeah, thanks for that. Whenever I have, I meet someone out and about, not that I go to parties or do anything cool anymore, but before I had children, I would do things like that. I always recommend that they consider starting with seeing a naturopathic doctor, because we're really good for being able to say, you know what, I think acupuncture would be really great for this, or that would be a good adjunct therapy, or, because we're trained in doing physical medicine and assessment, we can kind of do that in our, maybe first couple visits, but we're really good for saying, you know what, like, you need to see the chiropractor for this, or this is a massage therapy thing, or this is, an osteopathic thing. So I think coming to see a naturopathic doctor, what we do, for those of you that don't know, we are sort of kind of your general family practitioner in the kind of field of more natural medicine, right? So we have a 4-year undergrad in the sciences and then a 4-year naturopathic medical program on top of that. The first few years of our training is pretty similar to what your regular doctor has taken in school, because anatomy and physiology and how the body works, it's all the same stuff. And then where we differ in the end of our training is in the therapies that we use and the approach that we take. So we're gravitating towards, more natural therapies. And then approach-wise, since we're privatized healthcare, we just have more time to kind of get to kind of some of that root cause stuff. So patients can come to see us for pretty much, any kind of general health concerns, and we can either help them manage that directly. We can order laboratory testing, whether it's kind of conventional testing through, Life Labs and the provincial system, or whether it's private testing, and kind of, work with them through their diet, their nutrition, act on any of those kind of things that come up out of order with their lab work, and then refer to other professionals where appropriate. So our website, www.auroraintegrative.com, and where you really need to check us out is on Instagram, though, because we have a famous Instagrammer.
So fun, your guys' account.
And it's just at Aurora_medical.
Okay. We like to round out all of our episodes with something super fun. Are you game?
Okay, please.
I imagine you are.
Please.
Okay. First question is, what would you splurge on diet-wise on your cheat day?
On a cheat day? Oh my God, it doesn't have to be a cheat day. I majorly splurge. My husband doesn't know. The good thing is my husband doesn't really grocery shop, so he doesn't know how much stuff costs.
Okay.
I buy so much chocolate. And like, I eat fancy,
Courtney.
I eat fancy chocolate, but I eat fancy I eat sugar-free, dairy-free, like fancy stuff. But I won't even wink at like a $6, bar of chocolate. And if, I guess if I was having a rough day, could I eat 2 of those? Absolutely. You know, could I
Really?
just sit in my car having a rough day? You know,
I'm going to reframe this question, Courtney.
Yeah.
What do you splurge on that's bad for you? So nothing
Yeah.
that's like, because you just said sugar-free.
Like,
and
I'm
all
like,
oh
that
that
no,
stuff.
sounds
but those are
terrible.
fancy things. Those are fancy things. Oh my gosh, what's bad for me?
Well, because you have a healthy diet. That's why we're asking this question.
I know.
Makes us feel less guilty.
No, you know, I'm a coffee. I'm a coffee drinker. I mean, and I ask a lot of patients to definitely consider cutting down on their caffeine intake, but I do partake in the
Yeah, okay. I do too.
cafe.
You know that.
Yeah.
Coffee cult. Okay.
Okay, coffee. One
Okay,
thing
coffee.
that you would do for yourself immediately if you didn't have your kids for the day, patients for the clinic to look after, or the clinic to look after in general.
Yeah. Could I do that?
Say it.
Yeah. No, I don't know. I do dream of actually. I was thinking of doing this for my birthday, but that's just a silliness. Just like getting a hotel room, okay? Just like even like a day room, okay? And just getting I guess just watching Netflix is what I should do. I also really want to get caught up on paperwork and just by
No.
myself
Yeah.
and like, you know, no one bugging me.
You started off really right
Strong.
in terms
Just kind
of
of a
in
dork.
terms of getting a hotel.
It's okay. I'll
room to
message
yourself.
Grant.
Okay,
This is your
Exactly.
wish.
That's what I was going to
I
suggest
want to
to
get a
you.
hotel.
That was
And you know what? Okay, yeah, I'm going to go to a hotel room and just like Netflix and I watch like garbagey things. Like
You're allowed.
yeah,
She does too.
Okay.
great. We
Top
should.
3 herbs you would bring to a deserted island. Question back at you.
Yeah, so I would definitely bring curcumin. It's an anti-inflammatory. You've probably heard of this, you know, turmeric.
No, but people say
Just-
different things. But
I mean,
yeah.
it just fixes a lot of stuff, and it's just very safe. And they're not going to have it on the deserted island. It's not going to be there. So I'm going to bring that. I'm definitely going to bring echinacea too. And
Oh.
echinacea, I know, is kind
Oh.
of like, does that even do anything? You know, the patients will say this to me. Really good quality echinacea, super purposeful, and it's safe in a lot of patient populations. You know, so I would definitely, and it's just applicable for so much, you know, kind of antiviral, antimicrobial. And what else would I bring? I'd bring, you know, ashwagandha, and that sounds also like people
I
have heard
have
about
that.
this.
You
Oh,
told
you
me to
have
get
this?
that.
Yes,
You
I'm
made me
sure.
get
I'm
it.
sure you
Yeah.
have this. So, you know, it's if you Google it, adrenal support is kind of the big thing, but it's an upper and a downer. You know, it'll kind of help lift your mood and your energy. If you're feeling kind of tired, it'll help to, you know, kind of chill you out. If you're, you know, feeling a little buzzy, it's just super applicable. And they're not going to have it on the deserted island. It's not going to be there.
Okay.
I would bring those,
Okay.
and I need them all.
A doctor or health practitioner who has influenced your work.
Oh my gosh, my partner, Amber, Dr. Amber Eckel.
She's amazing.
I mean, she's just. I
Hi,
mean,
Amber, if you're listening.
oh my gosh, she's just so fantastic, and I am constantly in awe of her. And she's one of those people who doesn't know how fabulous she is, and I'm sure she would be embarrassed to hear how fabulous she is. But just working with her and her calm and her poise and her professionalism, I want to be more like her constantly. She's just really inspiring, and she's also been really forgiving of my major mom brain that I've had, you know, for the last 4 years. And
I mean, just so you know, though, she says very similar things about you. So I think it's
that's
a good
hilarious.
partnership.
yeah.
Yeah.
What are top 3 vitamin deficiencies you see in your patients?
You know, I never really tested it a ton before, but in the last few years, I've seen a lot of vitamin D, the sunshine vitamin deficiencies, to the point that I've just started testing it on way more patients. And I don't exactly know what it is. If it's, you know, we're spending more time indoors, we've had all this kind of COVID period of time of, you know, being more careful about going out and about. But I've definitely seen that, and there's lots of implications for that. You know, there's mood, there's immune system, there's energy, there's lots. So vitamin D. I definitely see B12 often too, and B12 is involved in energy and metabolism and mood and all these things. That's an important one. And then not a vitamin, but a mineral deficiency I see a lot is iron. Gosh darn iron, especially in female patients that are overdoing it. Maybe realtors.
Yeah, maybe. Well, that was the last rapid fire question.
Cool.
We so appreciate you coming in today. You really are in your zone of genius and element when you're helping people with their health and all the different levels of people that you help. So, I mean, obviously I'm a patient, so I appreciate it. I'm feeling a lot better. I know we have a long road though to be optimal. So I'm looking forward to getting there. And yeah, everyone, if you, when you're listening to this podcast, if any of this applies to you, you can get in touch with Dr. Courtney or Aurora Integrative Medical Health.
Thank you so much
Thank
for
you.
coming in.
Thank you, ladies.